Hey, this is Malika of Evanston Live TV, and I am sitting here with GI Doctor. I'm saying GI because I'm afraid I'm going to really jack up the word gastroenterology. Sitting down here with Dr. Troy, Dr. Tara Troy. I was contacted via email that this was a woman that I really needed to sit down with. She's respected. I did my research on her, and I just really felt like Evanston Live TV viewers need to know who this woman is, meet her. She's very personable, and that's what I love about her, is that she's not that doctor that's just, many of us have had that experience where the doctor is just trying to, meet a quota and work out their deal with the pharmaceutical company, and we're just, test animals or something, and they're getting their cut of the pharmaceutical drug or something, So many of us have, really been trying to find just a really good doctor who really cares, and that's Dr. Tara Troy. She is all about knowing her clients, knowing who they are, and she wants you to know who she is. So that is very, very important. So I'm going to turn this around and let's get to know Dr. Troy.
Hi there. Thank you so much for this opportunity. It's so nice to meet everybody.
Thank you for your time today. So I'm not going to jack up the word. Again, you're a GI doctor.
Correct.
So give people just a little background on, I read up on you that, your mother was a nurse.
Correct.
And you said as a little girl you wanted to be a doctor.
Mm-hmm. So I don't know exactly why, but I know that I always wanted to be a doctor. And my mom, thank goodness, was a hoarder, and she saved this cartoon drawing that I did when I was about 7 years old that said, "I can't wait to be a doctor and take care of my first patient." So as I went along in high school and college, it was just the path that I continued on. And thankfully, it's a really straightforward path. You go to college, you major in something science-based, you apply to medical school, you do medical school, and then straight through that, you can do residency and fellowship. Most of that I did in the Chicagoland area. I did go to college out at Penn, came back for medical school at Rush, where I met my husband, who's a pediatrician, and then I did residency and fellowship down in Hyde Park at University of Chicago. So that was kind of the trajectory. In terms of choosing gastroenterology, I ended up finding that to be such a good fit with my love of diagnostic puzzles, the ability to interact with people, because some of the subspecialties, a person is sedated for almost the whole time you're interacting with them, and I really love that human interaction and connection. So I gravitated towards this field where you also have a lot of tools to treat people. It's not just complex diagnoses, you can then actually help them, and I enjoy that.
Okay, so a lot of people, well, especially in the Midwest, we got a weight issue. Mm-hmm. We have a weight issue, and you deal in the gut area, the liver area. What are we doing wrong? I know that you were saying in the African American community, we're diagnosed younger with colon cancer.
Correct.
What do you think that is?
Well, we definitely know that there's an increase in the rates of colon cancer in younger people. And just a couple weeks ago, the American Cancer Society lowered their recommendation for everyone down to age 45 for colon cancer screening. Now, that hasn't been adopted by all the gastrointestinal societies yet, just because there's a lack of data to push to that move quite yet. But what it speaks to is that people's rate of being diagnosed with a colon cancer in their 45 to 49 has almost doubled in the past 30 years. And so the question is, well, what else has happened in the past 30 years? And that rate of obesity has just climbed straight upwards. We know that the risks for colon cancer, two biggies are things that you don't have in your control, are age and family history. But the big one that you do have in your control is nutrition. We know that diets that are higher in fresh fruits and vegetables, lower in red meat, lower in refined carbohydrates, minimal alcohol, and non-smokers are all less likely to develop colon polyps and colon cancer. So on the flip side, those individuals that are obese, that have diets that are low in fruits and vegetables, higher in red meat, higher in refined carbohydrates are going to be at higher risk. And that's currently the leading guess as to why there is this increased rate of colon cancer in people at a younger age.
Yeah, it's kind of hard for me to give up wine.
It's all about moderation. That's the key for everything. And having an area of expertise in liver disease as well. What is important as far as wine or alcohol choices is that moderation. For women, it truly is 1 or less drink per day. And some people say, well, let me just save it up and I'll get 7 on the weekend. And that actually doesn't work. Those binge drinking episodes can be more harmful. So for women, it's 1 a day, and for men, it's 2 or less per day. So you can have your glass of Cabernet, Zinfandel, whatever your preference, but just stick to the 1 a night.
1 a night. Okay, that's good. That's okay. 1 a night. That works. So are you able to, I know people who are overweight, it's obvious that there's some gut problems going on there. But for those who don't have a weight issue, are you able to pretty much on site, maybe through their eyes, through their skin, there could be some issues coming from their colon?
There certainly can be physical exam findings that can be appreciated, that can be a signal that there's gastrointestinal or liver issues. Things like, jaundice in the eyes. You can see the yellowing of the eyes with more advanced liver disease. For the gastrointestinal conditions, it can be weight issues in either direction. So people can be very thin. No problem. Or they can be carrying extra weight. And what's also very important about people who are carrying extra weight is the rates of malnutrition are incredibly high. So you may think, well, they've got all the calories in the world, but they're not the quality calories. So there's increased risks for vitamin and nutrient deficiencies that need that special attention. And there's recently been this big call to arms by the gastrointestinal societies to say, hey, GI doctors, you need to own obesity for multiple reasons. One, it's simply an epidemic, but 2, obesity has such an impact on so many gastrointestinal conditions. Acid reflux, which affects 40% of the population at any time. Something called non-alcoholic fatty liver disease, or just fatty liver. People may have heard their doctor say that based upon some mildly abnormal liver tests or some imaging. That's 30% of the population. And then it also puts you at increased risk not only for colon cancer, but also pancreatic cancer, esophageal cancer, gastric cancers, gallstones, gallbladder cancer. There's so many things that carrying that extra weight impacts negatively on the GI tract. So we have to do a better job of treating it. When you tell me you have acid reflux, I shouldn't just say, oh, here's the purple pill. I should say, let's work on those diet and lifestyle measures to reverse the problem in the first place. I've got the Nexium waiting for you, but let's tackle those other things that are going to impact your overall wellness as a priority.
Yeah, so I'm sure you've run across some doctors who are all about the profit more than actually caring. Do you ever have conversations with them? Like, what are doctors talking about amongst each other? Like the ones that really care, and then you have the ones, it's clearly the title and the money.
I haven't seen that many people who are focused on the money aspect of it, because honestly, medicine at this point in time is not the place to get rich quick. There's no doubt about it. I think the bigger issue is ease. What's easier? What would be easier for me to tell a person who comes to me saying they have heartburn? Would it be easier for me to say, here's a prescription, which by the way, I know is going to be highly effective, or would it be harder for me to sit down and say, let's talk about your weight? Is that something that you're concerned about? Is that something you have an action plan? What are you interested in doing about it? Would you want to pay out of pocket to meet with a dietitian, because unfortunately it's not covered by a lot of insurances? Are you ready to have an exercise program? Can you give up your wine, your coffee? Can you make sure that you don't eat late at night? All these things, that's not popular. Those choices are a lot harder to make than here's a prescription for Nexium.
How is the Trump administration? Is that affecting your business?
I have to say, with trying to get this small business going, I have been focusing on my here and now and not as much on how the governmental changes are going to impact me going forward. Is that going to be important at some point in time to focus? Absolutely, but I haven't looked at the nitty-gritty nuts and bolts of what that means. I do get worried about things like the fact when we had Obamacare that it did give people access to screening colonoscopies, which were so important. And I think I mentioned to you previously that of all the people that are recommended to have colon cancer screening, only 50% are doing so. There's numerous reasons why people choose not to, but cost is a major one. So if that ability to have that universal coverage for colon cancer screening goes away, I think that's really sad.
Yeah, yeah. A lot of people are out here with no health insurance, and they need to get tested for those types of things. Our diet is, and those on low income really can't afford to shop at Whole Foods and
Correct.
get the fresh fruits and vegetables.
Correct.
So they have to get the processed food because that's what they're. Do you have any advice for low income families, what they can purchase at stores that they can afford?
I think the key would be to stick to those fresh fruits and vegetables if at all possible. Now the question is, do they need to be fancy and organic? Well, the data's not so solid that that component is as necessary. And I think that's a secondary issue. You can choose organic versus or not organic when you have that time and money. But I think up front, the idea is to get in some of these fruits and vegetables. And certainly you can get them a lot less expensive at a place like Aldi than you could at Whole Foods. Would I love it if every neighborhood had phenomenal farmers markets that were affordable and locally sourced? That would be fantastic, but that's just not a current reality. Now, something that could be affordable and is not only a great idea for health and nutrition, but also for just wellness and engagement would be to have the room or the space to grow a little garden. Making your own food can enrich you on multiple different levels. Now, myself, I'm barely a gardener. I can keep a fern alive on my porch, but if you have that space and that time, I think that would be a wonderful option.
Okay. All right. And where can people find you?
So I am located now in Northbrook. So Northbrook is so nice and convenient because it's got, I'm right at the corner of Lake Cook and 41, kind of near the Botanic Garden and Ravinia and Northbrook Court. And it's great because it's one of the exits off the highway where you can get on in either direction, north or south. You don't have one of those exits where you're locked in one direction only. The address is 40 Skokie Boulevard in Northbrook. It's across from Trader Joe's and the Nordstrom Rack. So from Evanston, it's only about a 15-minute drive.
Okay. And if there's one thing you really want to get out to people about taking care of their gut, their liver, what would it be?
I would say the two biggest things I would suggest is one, that focus on nutrition, not only what you put in your mouth, but how you prepare it. And then also if you just want to try and maintain that healthy relationship with food, you shouldn't be on that really restrictive diet that you're worried, oh my goodness, if I have a molecule of gluten, I'm gonna be in pain. I would want it to be that positive, healthy, nourishing relationship. And then the second thing is get your colon cancer screening done. Second most common cause of cancer deaths. 45 in African Americans should be coming in, and a lot of primary care docs don't know about that recommendation. And as I alluded to before, if you're 45 or older and you're noticing any change, an alteration in bowel habits, bleeding, weight loss, you are far better served getting it checked out sooner rather than later.
Now, I gave up meat like a year ago, and I can tell a difference.
Yeah.
What is it in meat that's just so bad for the intestine? What is it?
Well, I think a lot of what we're learning is there some sort of inflammatory cascade that's occurring? Do the components of certain foods have ingredients that can aggravate the gastrointestinal lining and perhaps cause some level of increased permeability where some of these, toxins, if you will, for the general public can get into the body and the bloodstream and not only impact on your gut health, but also your overall body health. There's a big move to thinking that heart disease, coronary artery disease, is really more of an inflammatory condition rather than a cholesterol sort of issue. So because we know it's about what types of cholesterol you're getting. Red meat, not so great, but something like an avocado and olive oil, salmon, that Mediterranean diet is really great for your overall health.
Interesting. So salmon, because I kept the fish.
Great.
Can't give up fish. Can't give up fish or seafood. What about seafood? I was told.
Seafood's a good thing.
Okay.
Again, everything in moderation, but these fatty dark meat fishes like the salmon, and then other things that I don't think are as common, like the mackerel and the herring and such like that, can be really good for you as well. So fish would be a wonderful thing to consume at the very least twice a week. That's what I try to do.
Okay, and what about chicken, pork?
If you have a choice between a lean meat like a turkey or a chicken versus something like a steak, always go for those leaner meats. Those are going to be better choices.
But it's best to, would you say it's best to just cut meat out?
I think it does not need to be an integral part of your diet. I think there's been this skewed view back to the 1950s about what sort of proportions we need of each food group, and I think the big shift should move towards those plant-based foods, those fruits and those veggies. For just a general rule, that should occupy greater than 50% of your plate, and the meat or protein component, it doesn't have to be meat. It could be in terms of legumes, beans, that sort of thing, might be a quarter or so, and then the other quarter could be some sort of complex carbohydrates. So if you have another simple rule is if you have the choice between the white bread choice or that wheat component, go for the wheat always. That's really beneficial in terms of trying to bump up your daily fiber intake, which Americans are terrible at. The recommended amount is 25 to 30 grams per day, and the average Joe American only gets 15.
Interesting. Okay, so I think we should just cut meat out. I mean, I feel so much better cutting meat out, just keeping the fish. It's just, I feel better. And I feel like it's not rotting. I was told it's rotting in our stomach, in our gut.
And that's not the case. It flies through, it makes its way out. But when it's there, is it potentially causing harm? And the answer is possibly. So I think your move to get rid of it is a great idea. The other thing that I would highlight about that is when you choose to make a positive choice for your health, and you are doing something for you that you have to actively engage and participate in on a daily basis, I feel that component, that little touch of self-care, is also really great for your overall wellness. Little moves like that, like, oh, I'll have that wheat bread sprouted grain roll with Panera rather than the white baguette today. Little things like that, I think they really add up, and you're just doing little pats on your back of taking care of yourself.
And there's a big debate on dairy. I mean, dairy comes from the cow, it's from an animal. What are your thoughts on that? Because I developed an allergy with dairy as an adult. Like, I didn't have a problem with dairy, but now my skin breaks out when, like, I love cheese. So I just had some cheese and I'm like, okay, I'll just be broken out for a few days. I love cheese that much. What is that doing to us?
Well, there's a touch of evolution. So when you were a baby and you had your mother's milk, you had to have the enzymes to be able to break down the milk because that was your only source of nourishment. As people age, they lose that lactase, which is the enzyme that breaks down lactose. So as people get older, oftentimes they become increasingly lactose intolerant, more common in African Americans than it is in Caucasians. So that's one component where you just don't do as well with it. It can cause that gas, bloat, discomfort, altered bowel habits. Separately, some people will have true allergies to it. Now, not being an allergist, that's not my area of expertise, but I think the crux of the issue is getting back to that skewed recommendation of how much dairy we've been told we need to have. And the answer is it's not that much. You can get those healthy things like calcium from green leafy vegetables. That would be a far better choice than, a big hunk of cheese. So I think look at dairy again in terms of moderation, and And then also, what are the best sources of dairy? Could you have a little Greek yogurt that has tons of protein, and then also the positive probiotic component to that too, which is, I think, where all of gastroenterology research, not all, a lot of gastroenterology research will be focused in these next 10, 20, 30 years. This world of a trillion microbiota living inside of your gut and its impact on your health, I think that's going to be the wave of the future.
Okay. I know I gotta let you go. You gotta get back to saving lives. I'm just trying to get as much information as I possibly can.
Yeah.
I heard so many great things about you, and I was like, yeah, I gotta talk to this lady. I did my research on you. So I have another question.
Yes.
So in terms of colon cancer, a lot of people believe cancer is more emotional and stress than actual physical. Do you believe that at all?
Well, do I believe that stress and your mind has an impact on your body health? Zero question, especially with gastroenterology. You know, I could talk for 2 hours, but your listeners, I'm sure, do not want, or viewers do not want to hear this. But your mind's impact on your overall body health is really significant. We're starting to get more concrete evidence on the how. In terms of the GI tract, did you know that 95% of your body's serotonin is located in your gut? So for some people that have these really common functional conditions, like if you've heard of irritable bowel syndrome, this affects 15 to 20% of the population, and it can cause abdominal pain and alter bowel habits. People who have it, or they have their friend, their neighbor, their coworker, their family member that has it, they're the ones that when they're nervous or when they're having stress, they might need to rush to the bathroom, before they get on a flight, before a big presentation, that sort of thing. And we know that the stress hormones that are released in the brain, that they are sending out signals to the gut that can alter the motility, that can alter the pain threshold. They're so interrelated. And I think these studies, this evidence-based medicine, has shown such positive impact on these functional GI conditions, but then also other conditions like Crohn's disease, ulcerative colitis, and even possibly cancer, which was your original question, when you have assistance with coping skills, mindfulness, meditation, in terms not only of your trajectory once you have a condition, but I'd be really interested to see more of these articles that can show the positive effects in terms of prevention. And that's what I'm trying to focus on, is not only what do we do after you're stuck with a condition, but how can we try to impact your health, wellness, and trajectory before you're afflicted by these issues.
Interesting. Okay, Dr. Troy, let people know one more time where they can contact you. Do you have a blog or?
Yeah,
Okay.
absolutely. So on our website is where you can get more information than you could possibly want to have. It's www.compgihealth.com, and that stands for Comprehensive Gastrointestinal Health. That's the name of my business. And it talks about not only me and my philosophy, but also the wonderful team that I put together with my nurse practitioner, my dietitian, my counselor / behavioral coach to help out with all the issues I just mentioned, and as well my fantastic front desk team that's there to answer the phones, answer questions, no call centers. This is Diane Johnson, an Evanston native, and another woman, Denise Hogstrom, who I just hired as well. And the phone number to reach them is 224-407-4400. And then again, the website has more than you could possibly want, and that's www.compgihealth.com.
Thank you so much, Dr. Troy. I've learned quite a bit today. At least I know I'm on the right track. I
Yes.
cut the meat, so I still got some work to go, as I get older. One more question.
Sure.
One more. For those out there who are, generations, my family has eaten like this, and everyone died well into their 80s, 90s. But food has changed.
It
The
certainly
way
has.
It's processed, so we're not really eating the way that, our elders ate. So what are some signs that you could have, other than being overweight? What are some signs that will tell someone you've got some issues going on in your colon and your liver, you need to go get it checked out?
Okay. Well, we really are looking for changes in bowel habit patterns. So you may be somebody who goes 3 times a day. That's fine if that's how things have always been. You may be somebody who has bowel movements 3 times a week. Again, that's fine if that's how it's always been. We want to know if there's alterations in that pattern, or if it's paired with other alarm symptoms like bleeding or weight loss or increased abdominal pain. Those things, they really need to be checked out. And your primary care doc, or even the local minute clinic, if you're having an acute issue, are wonderful resources to determine, I think this is within the normal range, and decide when you should seek out the help of a gastroenterologist. But at my company, we're more than happy to help people figure out if this is normal, simple, easy change with aging, because those things do happen, or is it something more concerning that merits more attention?
Okay. All right. Again, thank you.
Thank
Dr.
you.
Troy. I know I keep coming up with more questions. Like, I got someone who really cares right in front of me. So I think that's it. So I'm going to go to your blog,
Okay.
and I'll be reaching out to you.
Wonderful.
Probably coming in to see you very, very soon.
And I would be happy to help.
Okay. Thank you so much, Dr. Troy.
Thank you.